Hi, welcome to the fourth day of the Endo Masters. I'm Rui Pereira da Costa, organizer of the Endo Masters 2015, and I hope you are enjoying the Congress so far. It's true we had already several wonderful lectures, but this is a full immersive week of Endo, so there's plenty yet to come. Stick with us and you'll be able to watch amazing lectures, I assure you. This day begins with a special guest, not just because it's my only female guest speaker, nor because she is an extraordinary clinician in dentistry and rehabilitation, but mostly because she excels in the microscope-driven dentistry field. I'm of course presenting you Cláudia Worschech from Brazil. Cláudia did her specialization, master and PhD in dentistry at Unicamp. She was president of the Brazilian Aesthetic Dentistry Society, and she has founded Gênio Odonto, which is a center for advanced studies in dentistry. Cláudia's lecture will show us how the microscope can change our clinical practice in several aspects, changing not only the way we look at dentistry and endodontics, but at our profession in general. I'm sure you'll enjoy. See you soon.
Hello everybody, I am Cláudia Worschech. I live in Brazil and I am so proud to be here with all of you in this meeting. I'm not an endodontist. I confess it's a challenge being here lecturing for you endodontists who I know use microscope as a routine. But I hope in this lecture we can have also non-endodontists, generalists, restorative dentists like me. My intention here is to tell you why I decided to use a microscope and how I have been using that during my routine. I've been using microscope for the last 10 years, influenced by endodontists, great friends of mine. I've learned so much with them. I fell in love with microscope when I saw through the lens of one during an international meeting here in Brazil. During this meeting, it's common the companies magnifying flowers, seeds, or fruits. When I saw that flower magnified, I thought, how beautiful could be a tooth magnified? And minutes later, I saw one tooth. It was really unbelievable. When I looked through the microscope for the first time, I thought, one day I'm gonna buy one. I did not say this equipment is not for me. It was in 1999 and I bought my first microscope 6 years later. We can think this equipment is not for us, periodontists, prosthodontists, restorative dentists. It's idea completely wrong. Carlos Murgel is an endodontist here in Brazil, and I am a lucky person because he is my great friend. He was responsible for giving me right directions and helped me a lot to manage this new phase in my professional life. The concepts I will give you here in this lecture, I've learned with him. I've understood with him there are phases, motivation is needed, and much training. I've been training for the last 10 years. I've never stopped. In fact, we know when we buy a microscope, our intention is to buy an equipment that gives us precision. But when we buy the microscope, we receive much more than precision. You know what more we can receive? We have also received best ergonomy and best communication with our patients. It is fantastic, not only for endodontists. It is for me, and it also can be for you. It is amazing. Stay calm there. Don't give up. Continue listening to me. I will tell you calmly how the microscope can modify your routine. If you are newest user, experienced user of, or if you are planning to be user to buy a microscope. Frequently, we buy one microscope for getting our own satisfaction, for improving our status quo, for getting best results, for satisfying our patient concerning high technology, for satisfying ourselves, for saving time. We really have big expectations, and we being also anxious for reaching all of them. But let me tell you something that really bothers me. In my area, restorative dentistry, when I ask my colleagues, why don't you use a microscope? You know what kind of answer I've received? I don't need one. I watch much better without it. I can do everything perfectly. My restorations are beautiful. I don't need one. Cláudia, why you use microscope? And my intention is continually asking them, do you really see the limits? When I tell limits, I mean limits of preparations, limits between restorative material and tooth, our own limits, limits to recognize our failures, limits to accept changes. Sometimes it's hard to recognize it, to leave our comfort zone. It's really difficult in all areas, personal area, professional area, so on. But let's talk about restorative dentistry. I imagine all dentists want to achieve correct margins of restorations, perfect adaptations, aesthetic and non-aesthetic restoration without sensibility. Everyone makes these procedures trying to achieve that. But tell me, why many times we see non-perfect restorations, failures in adaptations, amount of adhesive cement over the veneer after fixation, procedures those also were made by excellent dentists, which have enough material and appropriate instruments to do that. And I ask everyone again, do we need a microscope? The lack of clarity and magnification in the operatory field can be the reason to make many mistakes. Inside PubMed, we have many articles approving magnification usage. There are no doubts in using magnification, we will improve our skills. Here I am showing you my own articles, but there are much more. Of course there are. Many papers emphasizing differences between doing one procedure with and without magnification. All control group use magnification and get better results compared with the groups which magnification was not used. Thinking that one group of Brazilian professors and dentists from here, Brazil, launched in 2008 a book involving all specialties, emphasizing the magnification usage in all areas in dentistry. Carlos Murgel and I coordinate this project. 2 months ago, a guide was launched to microscope users. It is very useful. It is available to everyone. It's free. It's enough. You access the link I am showing you in this slide and download it. I collaborated with Restorative Dentistry chapter, and I'm gonna show you some pictures from this guide, emphasizing why it is so important to restorative dentistry. We need to add a microscope in our routine as well. We can amplify one crack like that under the cusps. Would I be able to see that without any kind of magnification? I really don't think so. We can see in details here. A non-perfect adaptation of matrix in the premolar, and, besides that, we also see the cavity is dirty. It is needed to additional cleaning before the adhesive application. Under cusps in another picture, cusps of molars, we see residual carie. Look. Another sample where microscope is welcome in restorative dentistry is when we need to recognize minimal carie lesion. If you don't have a microscope, you see like the first picture. If you have one, you see like the second image. It is much better to make a clinical exam and diagnose in this way. Follow me in this case. Do you really believe someone wanted to leave this gingival tissue in this way? With so hard inflammation after installed one laminate or one veneer? I don't believe that. Pay attention on it. There is a big residual inside of the gingival sulcus. There are large amount of residual cement here into these gingival sulcus. Look, pay attention that. It's minimal, but for the sulcus it is a large one. Look. Okay. During our training courses, wherever I am, I show some images like that, and I ask the audience to point me where the failures are. Sometimes they tell me, the failure is on the left lateral incisor or on the right central incisor. They can easily recognize the gingival inflammation, but they can't recognize why it occurs. So, I always exemplify it by showing the same image magnified, and the resin become clear. Here, I added the scan electronic microscope image, only for becoming clearest this situation. I have many scanning electronic images, those I made during research at Unicamp University here in Brazil. All electronic images that I show you are mine, and I made those. They can easily recognize the gingival inflammation. Look. So, I show the audience the picture of the anterior teeth again, and now it's easier to recognize where the failure is on that tooth, for example. Another case where the microscope is very useful in restorative dentistry is when a flowable resin will be applied. If the flowable resin passes the limit of cavity preparation, it will be exposure on the buccal environment, and we know this kind of material don't have resistance to survive there. Probably after some months the restoration will fail. When the flowable resin passes over the limit of cavity, microleakage can occur due to a gap created there. You can see that on this picture. The incorrect matrix adaptation can provide some not sealed margins around the restorations class 2, for example. In fact, if the matrix is not in a right position, we will have non-correct margins, and surely we will have failures there. And we know to provide the correct margins adaptation is difficult to all dentists. However, if we see with an amplified view, we have less risks to make mistakes. When the margins are opened, the restoration has failures since you have finished it. Surely, the gap will bring the tooth to failure. What kind of failure? Opened margins allowed microleakage that would cause irreversible pulpits. So, besides to choose correct material to clean appropriately the cavity, the matrix needs to be positioned in a right way. Always, it is an important step and you can improve this step magnifying the operatory field. Magnification is useful to avoid mistakes like that, where the rubber dam is held between the cavity preparation and the matrix. To tell you about this fact can sound stranger, I know, but think in a superior molar with very difficult access, low light, no magnification, at the end of the day, after you have attended many patients, maybe amplification of the field and work using kind of light with do not present shadows can be a solution for that. Another simple thing we face every day in our clinic is to check all teeth and make a diagnosis and prevention. Microscope is useful in both cases. This image is very interesting to our patient. We record that and show that to patient, or we take a shot, a picture, and show them the picture. We can distinguish simple stents from caries lesion, and our decision can be based on that. And register why we drill or not to drill one tooth, for example. Our decisions will make always under magnification and registers about that. And when we decide to drill, we can determine until which limit we will remove this tissue. In restorative dentistry, another case where we can get precision is during the polishing, as I told you, and during the examination before the impression. Look, when we are gonna take impressions through microscope, we check in all details using magnification and the preparations. Had calculus. Patient had spent a long of time with provisional restoration, and in the moment to take impressions, we saw that calculus. Of course, we saw and we removed that. To evaluate the exact adaptation of laminate is another and useful aspect concerning magnification in prosthodontics. We can have precision when we apply resin during direct aesthetic procedures. Even the color we can identify better if through magnification we turn off the light of our microscope. Believe me, if your room is clear, bright, you can do it. Turn off the light of a microscope to avoid previous polymerization. In restorative area yet, it's common to find crack on the structure. Amplifying the structure, we can decide what to do with that, based on our knowledge, our background. Compare this first picture with the last one. There are big differences, Microscope helps us to check occlusion, to analyze it in details, and we can discover what is the main responsible for gingival resection in this case. Look, this tooth is moving. Both are moving. It's needed to make adjustments. We can check the margins of laminates after the cementation. If there is retractor cord, hold on that. If there is, we are going to remove that before the inflammation process be installed. We can treat what we can see. Of course, if we can't see this retractor cord, forget it. We will never remove that. Anyway, the amount of a retractor cord is minimal in this case, and it will not cause any damage of the gingival margin. Don't worry about that. In all cases, when we use the retractor cord, we need to be alert to these situations. Look, the adaptation is perfect. Having a well-defined preparation is another challenge to get perfect adjustments. Margin should be clearly marked off. This type of burr gives us precise wear, and we use it to make the preparation on the marginal areas, on gingival, in mesial, incisal, and distal areas. We just change the granulation, regular, fine, extra fine. And here is another sample where I've been working using magnification. Smooth finishing is the important step. We can reach smoothness using rubber points like that through high magnification. Look the smoothness I've got. It's perfect for take impressions and make the ceramic after that to install. Checking the ceramic adaptation comes next. It should be done before the ceramic internal preparation be done and before the isolation, and we can check how the ceramic restoration fits. After total isolation, the quality of adaptation is clear, and as you can see, it is very, very good in this case. And you need to check through microscope whole margin, not only cervical margin. Because sometimes the cervical margin is okay, while lateral margins or incisal margin are not. If we have discoloration in any margin, we have the ceramic performance interrupted and it will need to be removed. When we have perfect adaptation, right after the removal of the isolation, we can see in details how the transition area between tooth and ceramic is. Don't worry about the color here, okay? Because the rubber dam was removed just in this minute, so it is normal. We have a different color between one tooth and another teeth, okay? Due to dehydration process. With microscope, you also can apply XD inside a small laminate in a more effectively way. I prefer don't hold the laminate and apply XD. I've preferred just use 2 microbrushes and apply the XD in this way. It protects the laminate, and we make sure about where the XD was applied and if it was applied in the entire margin, and so that we avoid applying XD on the buccal face, of course. We have chosen this way to apply XD, primer, agent, and bond. It is simple and helps us a lot. You just turn the laminate around its center and checking the XD application through high magnification. Concerning the fixation agent step, I need to give you another advice. Because of the wetness ability property of these materials, you need to apply fix agent on the tooth which will receive the laminate and apply it on the inner part of ceramic. Take a look at these videos. In both of them, we are applying fixed agents. This procedure can help us avoid bubbles between the laminate and the tooth. Try to do that. You will see that it is different. The laminate can be fixed and resin is spread throughout the internal surface. The cement should be applied in a homogeneous layer over the tooth surface and also in the interior of the ceramic. This procedure avoids failures in some areas, which could result in color alterations. To control the pressure over the ceramic is very important for avoiding damage, cracks, microcracks. Cracks are common in our teeth. Look at this video. Pay attention how much this tooth moves. There is a superficial fracture on the buccal surface. It's a tooth, not ceramic. So, enamel may be suffering under extremely force from occlusion. Imagine ceramic. Imagine this force over the microlaminates. This force certainly would cause gingival resection, cracks in ceramic. We need to see that and to make adjustments. When we make restorative procedures, mainly static ones, we would share responsibilities with the patient. It is really impossible to keep marginal integrity if there is large amount of plaque, because it can compromise the result, promoting the degradation of the cement line, degradation of the dentin or the enamel which received the adhesion process. The patient needs to be co-responsible with us concerning their restorations, preservation, or any kind of procedure in dentistry. Marginal integrity can't survive to this challenge for a long time. It is very important to make it clear to them, the patients. The care is important in order to preserve the integrity of ceramic restoration. Look, when we have non-prepared laminates, we have a kind of over-contour in these restorations, and the patient needs to take care of it. Patient needs to clean it very well. We frequently recorded these videos using high magnification to show it to patient. Microscope is used in restorative and prosthodontics procedures, also to check and to reseal imperfections. To identify this kind of failures, magnification is used. This kind of imperfections many times can't be seen by naked eyes, and we need to reseal these margins to avoid problems. Through magnification, we can improve the polishment. We can observe in details all preparations. Look here, I am polishing using a rubber dam. Look, I use a rubber dam to do that. And I try to enter with the rubber dam point until there in difficult areas, but we try to do the best polishment. Sometimes, of course, we cut the gingiva, we make pressure, of course, but it's a reality too. Look how easier is to cut off and remove the excess of material from the ceramic surface. I really love to work using microscope. When my colleagues have asked me how I use microscope or when I use microscope, I really think where I cannot use it. How can I do procedure without one microscope? Because we become a kind of dependent of good light and very good images. It's not easy to explain if you don't use microscope yet. You will not believe in me, but try to attend hands-on courses where you spend one day working with magnification and very good illumination. And at the end of the day, you will understand me a little bit. We will understand what I can tell you. Look, it's perfectly, the operatory field is very clear. You can work calmly and doing a very good job, very good work with precision all the time, every time. And now, tell me, honestly, can you see these details without any kind of magnification? Inappropriate light? Because if we can't see, we can't treat. And if failures exist, we need to make another restoration, another intervention, retreatment, replacement. When we take off one restoration without magnification, the chances to removal healthy structure is bigger than when you use any kind of magnification. The same thing can occur in an opposite way. When we can't recognize where the limits are, we can leave part of all the restorations around the cavity. If it is amalgam, okay, it is easier to distinguish, but if it is resin, we will need any kind of magnification to avoid overwear or not enough removal. Probably, if you are a dentist and work as a dentist, you have found parts of amalgam restoration under resin restoration, recently added. I have seen it with high frequency in my clinic. Amalgam remains. The magnification amplifies your skills, but you need to know how to perform the appropriate technical procedures. The microscope will not do anything for you. Nobody will be transformed in a good dentist because it bought a microscope. Your choices, your skills, your philosophy, your background, of course, will determine what you will do and how you will do it. Okay, so after this long explanation, do you think the microscope is just for endodontists? I hope I have gave you good examples why, how, and where we can use a microscope in our daily. But I know you are thinking, why microscope? Why not loops? The reason I'm gonna show you two important features you will get using microscope. When you buy a loop, you can get more precision during operator phase in all procedures. Of course you can. But, come on, prefer loops instead naked eyes and microscope instead loops. If your intention is to buy loops, go ahead. It will modify too much your quality during the work. Believe me, it's the first step. However, you will not be available to receive the other two benefits that microscope allows you to receive. Okay. One of these benefits is ergonomic improvement. And another one is the best way to have communication with patients. Okay, until here, I hope you have considered all my thoughts and samples. We are gonna talking about ergonomy. Okay, without the microscope, without the loops, look, we work in this position. We have nowadays many instruments, many materials that requires very good applications. We requires more than one step. We need to control many variabilities. Of course, we can continue working this way, but we can choose to overcome this. Okay, look at these images where we are using microscope and the image was made from another angle. This is perfect. Do you agree with me? Look, the position, the ergonomy, the facilities. It's very nice to work in this way. When we work through microscope, besides we have our arm supported by a chair, because everybody can have the arm supported by a chair, independent of be or not be microscope user. But our body being more comfortable positioned on the chair, the distance between the patient and the dentist is comfortable. Dentists do few movements, keeps the spine, the background in a right position. It's not needed to be curved on the patient trying to watch. We can get images through microscope and see these pictures or videos in a different ways. We can watch it by the television or by the monitors, using one monitor for you and another one for your assistant. It's cheaper than you buy an auxiliary binocular, for example, and it is useful to your assistant. But look at the position, the ergonomy. It's very nice. We can do that, taking pictures with microscope easily. I know this position is not perfect yet, but it works. I have been getting 100 of images per week. In this way, ergonomic way. Okay, now we are on the last part of this lecture. Finally, you can improve the communication with our patient as well. How? Getting photos, movies before, during, and after procedure execution. It is different to get images from the microscope and to get images from the camera. Look at these movies and compare one to the other. Can you notice the difference between them? I can take many photos without need to move my chair. To pick up the camera there on the furniture, the balcony, I can continue doing what I were doing without interrupt the working flow. And we can show all the images to our patient. And I know you might say that using a powerful camera you are able to get the same result. Of course you can, but you can't treat and use the camera at the same time or using the micro camera associated with the video at the same time you treat. It's impossible. You will register images before and after, never during the procedure, unless you stop what you are doing to take a picture or shot, or you can continue doing and someone will take photos for you, but you can't to do both, taking photos and continuing working without a microscope. Sorry, you need to make a registration before and after, just it. You will not work using magnification. You will work using your eyes, naked eyes, and you will get magnification if you get images from camera. Okay, come on. Also, concerning communication improvement, in the past it was common to draw pictures to exemplify cracks over counter. Nowadays, it's better to see real images, not only drawings. So, if you practice restorative dentistry, prosthodontic, periodontic, orthodontic treatment, and you don't have a microscope, you will not have access to these benefits. It not mean, of course not, you will do inappropriate work. No, never. I never would talk that. But you will not receive all these facilities. The endodontists will agree with me. Why do just endodontists can receive these benefits? I am thankful to endodontists that opened the spectacular opportunity to us, other specialists. We are always seeking for a professional success, and we can fulfill it by working with precision, best communication, and ergonomy. I am sure you work better in our clinical cases adding them. Precision, ergonomic way, better communication in your routine. But is there any disadvantages? What do you think? Yes, of course. Of course, yes. The main disadvantage I see is the initial investment. That is high. We need to make this choice. We need to plan and invest. If we have the amount of money to invest, we do it easily. If we have difficulty to pay it, we need to choose what we need to cut off from our lives. Travels, to buy a new car, to do one specific course we would love to do, so on. If we don't have any money, we need to make a loan, lend some money, so on. Before all alternatives, you need to make this choice because many people has money and don't have a microscope. It is also and mainly a choice. And we need to avoid choices like that, of course. Really. It's a joke, but in the same time, it's true. Completely true. Okay, another disadvantage we recognize is the learning curve. You need to invest time and effort to succeed. Many dentists bought a microscope and gave up due to many reasons. Among those is the lack of training. So, we usually listen from them. Microscope doesn't work. So, if you are going to buy one, please look for a training center. Be prepared. Give time to yourself. Step by step. Training every day. First of all, in mannequins, making preparations, cutting plastic gingival sulcus. After that, try to touch extra teeth that were removed from mouth. Filling, making cavity, pasting, pieces, drill, suturing. You need to train. In another step, receive the patient. Use a microscope to make diagnose. It's interesting. But if you don't have training, if you don't need how to manage the microscope, I like to call this phase in fight phase because you fight a lot with your microscope. You move, and never start to work because it is difficult to achieve good results from images. It's much better, much important to get training before you treat patients. Okay, until you get a good performance, you need to training. You need to training after that to training forever. Yes, you get good performance. You will feel comfortable when you get confidence and when you work you using microscope for some months, some period. It's a variable from one to other people. we need to have this time for each and for others. You need to prepare yourself by day, uninterrupted. Training is needed since the beginning. I don't believe any person can get resourcefulness without any kind of help, any devices. Because of that, we have teaching in different places, teaching professors at universities, teaching inside the companies. Here is in Japan in 2009 with Masayuki Okawa, my friend, teaching in Buenos Aires, Argentina, training the professors there, professors that are not in the dentist, restorative dentistry, perio, prosto, all professors were there in teaching. What's important is our colleagues to be willing to learn, and our function is to motivate them always. Many times we have listened from people. I learned that the overnight. Forget it. Be cool. Choose better your friends and go ahead. Do your best. You can. Find one training center. Find one training center in your country. I'm sure there are centers for you. But you need time, patience, and a lot of training to overcome the learning curve period. Don't give up, please. Stay calm. Don't allow your microscope to become the most expensive hanger you have ever had before. Please. It should not happen. I trust you. I know you can prove this different way to work. I hope I have added something in your professional life sincerely. And I'm gonna be available if you have any questions or comments. Please contact me anytime. Follow me on Facebook, I will answer you. And be my special guest during our microscope meeting here in Brazil next October in São Paulo. I don't forget to tell you, download this guide, take a picture of this slide, take notes, download it. Many of you, many things that I show you stay here inside this guide. I am sure it will be useful for you. Thank you so much. I really appreciate this moment. I hope you have understood my statements, my thoughts. If you need or want hands-on courses, training courses, try to find one in your country, as I told you. But if you don't have anyone, we have this center in São Paulo, and we have been offered hands-on courses in all areas over all year. Brazil is a crazy country to live in, believe me. We certainly have many problems about safety, public health, education, politics, corruptions. It is the most important problem here. But, on the other hand, we have wonderful landscapes, marvelous place to be visited, and above all, Brazilians are very friendly people, and we can welcome all of you and give you our generous heart and open hands. Please keep in touch. I would like to invite you to join me on Facebook and to visit my websites. I hope I have added something else in a professional life of you. If I wish you could have improved. I wish I could have contributed to some aspects in your career. In fact, it's not so easy to talk about unsuccess. Although, as I am researcher, teacher, professor, I think this kind of discussion is necessary to our improvement. I am a dentist. I have been trying every day to become better than I am now. Okay, if you have questions, please let me know. I try to answer them in the best way I can. Thank you very much for so kind attention. Ciao, bye bye.